Hello, my name is Heidi Krimmer, and I am currently a fourth year social work student. My research topic was factors of substance use disorder with a focus on the marijuana gateway hypothesis. The marijuana gateway hypothesis was introduced by Dr. Denise Candle in the early 1970s. In her article, Stages in Adolescent Involvement in Drug Use, Candle stated that marijuana usage increases the likelihood of an individual using harder substances such as heroin or cocaine. Candle's research has repeatedly been used as justification for the criminalization of marijuana usage. There has been a significant amount of research released over the years that contradict the findings of Candle. One example of this research is from Zimmer and Morgan, who proposed why many people believe the marijuana gateway hypothesis to be true. They state that marijuana does not cause people to use hard drugs. What the gateway theory presents as a casual explanation is a statistical association between common and uncommon drugs, an association that changes over time as different drugs increase and decrease in prevalence. In the end, the gateway theory is not a theory at all. It is a description of the typical sequence in which multiple drug users initiate the use of high prevalence and low prevalence drugs. My research questions were, do people in recovery perceive marijuana as a gateway drug? And what do individuals with substance use disorder identify as factors that contribute to addiction? The purpose of this study was to gain insight on the marijuana gateway concept from the perspectives of those with histories of addiction. The study was also intended to identify the risk factors of addiction. The participants of the study included 7 women who are currently in recovery from substance use disorder. Participants are all current residents at Off the Streets. The age of participants range from 29 to 62 years old with a mean age of 42. All women in the study are currently experiencing homelessness, and all of the participants are clients I see on a regular basis during different groups at Off the Streets, one of which I facilitate weekly, and all participants voluntarily chose to take part in this study. The setting of the study was Off the Streets, which is a homeless shelter and substance use treatment program that serves women with histories of sex trafficking and exploitation. A message from their website reads, the goal of the program is to provide a network of gender-specific services for women as they explore and practice positive changes in their life and receive needed services. Off the Streets assists women who are involved in prostitution, sexual exploitation, and human trafficking move toward safety, recovery, empowerment, and community reintegration. This is a qualitative study, and participants were chosen through non-probability convenience sampling. Participants were given a 15-question survey through Google Forms. The survey included multiple choice questions about family history of addiction and the presence and frequency of marijuana usage in the household growing up. Short answer questions asked about personal history with substances such as first substances used, age of first use, age of first marijuana use, and the specific substance that had the most negative impact on their life. Long answer questions. 1 asked participants to explain whether or not they thought marijuana was a gateway drug, and 2 to identify risk factors they believe that contribute to addiction. 6 out of 7 participants reported having a family of substance abuse. The 6 participants with a family history of substance abuse all reported that while growing up, people in their home smoked marijuana, and all but one of these participants stated they were exposed to it on a daily basis. Age of first illicit substance use, such as alcohol or tobacco, ranged from 9 to 18 years old, with a mean age of 14. Age of first marijuana use was ranged from 9 to 35 with a mean age of 16 years old. When asked if they had a significant problem with marijuana, all participants stated no. Only 1 of the 7 participants stated marijuana was the substance that had the most negative impact on their life. 1 person stated alcohol, 2 people stated cocaine, and 3 people stated heroin had the most negative impact on their life. 3 participants believe that marijuana is a gateway drug, and 4 participants believe it is not a gateway drug. For this question, a few people just responded with a simple yes or no. Others went more in depth. One person responded, "Yes, I am a firm believer that it can lead to the usage of other drugs that are not good for you." Another response stated, "No, because it's non addictive and doesn't destroy your life and cause you to completely use yourself." When asked to identify risk factors of addiction, the responses varied. One person stated, "Homelessness and being alone with too much free time. Not having a job or adequate housing can also lead to addiction. I say this because I see a lot of it in the city of Ohio." One person stated, "People, places, and things." Another person simply responded, "Pain." Another person wrote, "I believe growing up with drugs or alcohol in the household can cause you to become an addict." The mixed results of my research are consistent with the findings of a 2022 study published through the University of Central Oklahoma. When the participants of this study were asked if they believed marijuana was a gateway drug, 45% held mixed or conflicting views, 35% did not agree with the marijuana gateway concept, and 19.6% strongly supported the marijuana gateway concept. Overall, given that marijuana policy continues to change while causing a significant amount of controversy, it's clear that more research on the topic is needed. And here are my references, and thank you for watching.